I'd like to thank Richard for taking 24 hours to come up with 3 jokes for me. Really honored. So if any of you know Amanda Frank, she's one of the happiest people I know. And even when I told her about the presentation I'm doing, she goes. So what I want to do today is I want to talk about a few things. I want to talk about an area of local concern and an area of local success. And so the first one is something that we've seen in the papers, something we've seen in the national news. The Center for Disease Control has labeled opioid consumption as the most impactful drug epidemic in the history of the United States. If you've ever watched Narcos on Netflix, this is a big statement. So one of the biggest issues is that opioids do have legitimate medical uses, but they are misabused and quite significantly. In fact, if you look at the #1 indicator of who is prescribed opioids, it's if you have mental health issues, not physical health issues. And so that's problematic. And so we want to ask ourselves the questions, are opioids being prescribed more in Kern County because providers are so few and they have so many patients? They have to see patients. They have to get through the backlog of patients with decades of health issues. And the only way to do this is to try to move them through their office as quickly as possible. Or are opioids being misprescribed? It's probably not as much of an issue in Kern County as it is across the rest of the nation, but a big issue in healthcare is provider shopping. If you've ever listened to new doctors' advertisements on the radio, the end of the advertisement is always like, if you're a new patient, don't ask for drugs. Dead serious, it's what they do now. People go and they ask for drugs constantly. And so if you look in Kern County compared to California, we have fewer primary care physicians, fewer registered nurses, fewer nurse practitioners, fewer physician's assistants, fewer surgeons, doctors of orthopedics, and less total healthcare employees. So we have an issue with the number of healthcare workers in this county. It's a known issue, and it's one that we've known about for years, one that we haven't been able to solve. But if you look at the healthcare salary of healthcare workers in Kern County. It's $45,000. It's a quite substantial wage. It's $42,000 in the rest of California. And if you look, there are quite significant benefits to living in Kern County to the rest of California. Look at heroin consumption. About 0.2% of the population in Kern County consume heroin, same as California. We also have populations that are less healthy in terms of physical health and mental health. So again, we have issues. And so what we wanted to explore was to see what drives opioid use in Kern County, and then what can we do to attack these problems. And so that blue line is bad. That blue line in California says the more doctors we have, the more opioids are prescribed. That's not a good thing. And if you look, the green line is physically unhealthy days. So the population is getting healthier, but more opioids are being prescribed. Again, what happens is we are seeing people being misprescribed opioids. They're being misprescribed opioids for mental health conditions that are not being treated effectively. California is the opposite. California is getting healthier but prescribing fewer opioids. So this seems to be a county-specific finding where we're seeing these opioids being prescribed and we want to know why. What's happening? Well, here's the one area where we can do a lot of solving for our opioid issue. Robert Price mentioned it in the Bakersfield, Californian a few days ago. If you look, the more healthcare workers that you have, the more support staff that doctors, nurse practitioners, physicians' assistants feel that they have, reduces opioid prescriptions. Doctors are more able to take time, spend with their patients, get to know their patients, get to know the health conditions, find out what's wrong with them, and don't have to just shuffle them in the office, 5-minute meeting. So support staff is integral for healthcare. It could actually help solve the opioid crisis here in Kern County. More support staff, medical assistants, front office staff, all those sorts of things. And if you look, the more we pay the support staff, the more wages we pay them, the more we attract, again, the lower the opioid prescribing rate. Providers feel less rushed. They're more able to help their patients, and they are less likely to prescribe opioids. It's an easy solution. Doctors need support staff. Doctors need people who can run through patients' health histories, who can guide doctors to the right decision, who can help what's going on. So support staff matters a lot to the providers. Again, providers need support staff. It improves the patient outcomes. The more healthcare workers you have, the better off that patients are. But it also helps limit negative provider behaviors. The improper opioid prescribing. Again, doesn't seem to be an issue in Kern County that doctors are worried about losing patients, so they'll just give them pills. But it seems to be an issue nationally and something that we need to address. So we don't want to look at the failures of the healthcare system. We know that there's two sides of the market. The supply side of the market, the demand side of the market. So we want to look at the population behaviors that might be driving some of this. So why do we look at opioid prescriptions? Why do we look at these things? Well, since 2010, 12.5 million Americans have misused opioids. That's a lot of people. Just this past year, it was 2 million new abusers of opioids. So it's an incredibly large problem. So who is more likely to use them? In terms of demographics, more non-Hispanic whites, more females, tends to be the midlife, later life health issues that crop up, and younger individuals have higher opioid prescription rates. In terms of socioeconomics, areas that have lower incomes, fewer college graduates, and more rural areas, which we see in Kern County, are hotbeds to lead to these issues. But we want to focus on personal behavior. What's the biggest predictor of who will be prescribed opioids? And this is looking nationally. Poor physical health is dead last. Poor physical health, which should be the main indicator of who gets prescribed medicines, is dead last. Diabetes is third. Obesity is second. Mental health. We have a mental health crisis in this country. We don't have enough staff. We don't have enough money. And so what can we do at the county and state level to help the overprescription of opioids? So we must mandate that providers access a prescription drug monitoring database before prescribing opioids. Seems pretty common sense, right? Didn't get implemented in California until 2019. This year is the first year that doctors actually must look at a database to see if their patients have been prescribed opioids. And these databases don't get updated daily. Sometimes they get updated quarterly, so every 3 months. Again, simple solutions that we can use to help determine if a person has a legitimate medical excuse or a legitimate medical need for opioids or is a drug seeker. We're also worried about provider shopping. People taking the same prescription and going to different pharmacies. Getting multiple prescriptions filled with just one. So what can we do to solve this issue? And again, it's support staff. We need healthcare support staff that can support our nurse practitioners, our doctors of orthopedics, our physician's assistants. And so we're talking about prescription rates. Okay, so they get prescribed. We have to look at the negative outcomes. So blue is bad. And if you look at Kern County, the higher prescriptions lead to higher overdose rates and higher emergency department visits. So this is from the California Department of Public Health. So I had an economics student, Anthony Ponce. So if you like GIS, hire Anthony. So he did this all for me because old dogs don't learn new tricks. And I tried to make it and screwed it all up. So this is a map of opioid prescriptions by zip code in Kern County. It's not a rich issue. It's not a poor issue. It's a county-wide issue. Darker is worse. So you look, East Bakersfield, Lake Isabella, Tehachapi, West Bakersfield, we all have these issues. It's a county-wide problem that's in need of a solution. And so if you base it based on something known as a healthcare provider shortage area score, we see the exact same issues in Kern County. Well, again, problematic. It's hard to develop policy with a multifaceted issue. As Dr. Thornburg mentioned, a lot of times we just don't focus on the right questions. And one of the biggest issues is policymakers base their decisions on the average outcome. It's easy to measure, and it's likely to impact the most people. But we know that opioids impact everyone, rich, poor, every ethnicity, every age group. So is this wrong? So every clinic in Bakersfield has something known as a healthcare provider shortage area score. It's federally calculated. It's basically a measure of lack of access to care. It's out of 26 points, we're 20. So it's very low, it's very high, so very bad. But in areas in the most desperate need of doctors or clinics, if we just provided more doctors without any more support staff, that does not solve the issue. In fact, if we just increased the number of doctors without increasing support staff, again, like medical assistants, the number of opioids would double in Lake Isabella, Fraser Park, California City, these outer-lying communities that have health care issues. We also have to beware, so this is kind of not necessarily the best thing. Heroin and opioids, I've been told, are substitutes. And in areas with the highest heroin consumption, there are 4,000 fewer opioid prescriptions annually. It's a law of unintended consequences in economics. With the advent of these prescription drug monitoring programs, which has made it harder to get opioids by individuals, people have actually started switching to heroin. Not necessarily the best thing. So that's kind of my talk on what I think is a big challenge for us to face in Kern County. Now I want to look at something where I think we've had an incredible amount of success here. And it's been done through the high school districts, the elementary school districts, community college, college level, everywhere. And the educational and income outlook for Kern County is massively improving. And so, if you look, I can separate out individuals to whether or not they were born in California, whether they're born in the United States outside of California, or whether they were born in a foreign country. And if you look across the board, we are getting fewer people without a high school diploma. In this day and age, a high school diploma is it's just necessary. You can't have a career without a high school diploma. We've seen increases in the number of people with high school diplomas. We've seen increases in the number of people with some college or an associate's, number of people with a bachelor's degree, number of people with a graduate degree. But we're not just importing these people. They're actually being born and raised here in Bakersfield, and that's important. We've successfully transformed the educational outlook here in Bakersfield, here in Kern County, so that more people are graduating with an associate's degree, largely from Bakersfield College, a bachelor's degree, largely from CSUB, or graduate degrees. They're homegrown. Those are the people that will stimulate the economy. But again, you sit there and you look, do you need a college degree to be successful in Kern County? No. It's not just college necessary jobs that can provide a suitable lifestyle in Kern County. And so if you want to get like the comparable wage in LA or in San Luis Obispo counties, multiply it by about 22% or 11% if you have problems with the calculations. Again, Amanda Frank, economics major, she can do this off the top of her head. If she can't, we'll need the degree back, Amanda. So if you look, yes, we have fewer plumbers. Yes, we have fewer construction workers. But look at the number of electricians, look at the number of mechanics, and look at the wages that they've been paid over time. It's much higher than minimum wage. $24 for any level of plumbing is a pretty decent wage. Not the best, but you can make a living off of that. Construction workers make more than minimum wage. Electricians make a lot of money. So it's not just these college-ready jobs that are necessary for the workforce. We don't need to funnel every student into a college education. There are opportunities in this area for people with just a high school diploma to be successful. So while white-collar employment is up, it's fantastic, blue-collar employment leads to solid wages. And is that the case across all blue-collar workers over time? So in 2005, the average household in Kern County receiving welfare got about $6,000 in benefits. That's kind of a measure of poverty or a lack of income. In 2017, it's $4,700. It's massive improvements in the economic opportunities of a lot of the lower income individuals here in Kern County, which is good. So even though the poverty rate is high, the economy is very equitable. People can live a decent life here. We have to make that a selling point, a continued selling point of being here in Kern County. And if you look, we can look at changes in educational attainment. We can break it down for all people, males, females. We know that there exists some gender wage gap. Not the media reported, they make 30 cents on the dollar, those sorts of things. But look at the catching up that females have done in educational attainment. We are slowly letting more and more females into our economy, and it's created this massive improvement in economic outcomes for everyone. Look at the poverty rate by the educational attainment. Again, we've seen massive improvements mainly among females. Again, look at median household income by educational attainment, how much it's changed. Again, females have benefited tremendously from the opening up of jobs here in Kern County, from the opening up of educational opportunities, blue-collar opportunities. So we're seeing an economy where housing is affordable, has been mentioned, where a lot of new industries, healthcare, logistics, light manufacturing, have bright futures here as employers seek alternatives to high rent prices or high prices elsewhere, where workers can't afford to live. So there's a lot of opportunities, and it's not just concentrated at the top or the bottom. We were talking about wealth inequality earlier. Wealth inequality is an issue. But here in Kern County, we're doing a pretty good job. We've seen the successes over the past 12 years. And with new initiatives at every level of education, I think we will see quite a bit more. Thank you.